question.
Yeah. Okay.
Hey. Right. So if you have read and understood considering it clinical examination station, kindly please begin.
So I'm going to enter the examination hall, wash my hands. Hello, good morning. My name is Dr. Ufat and my candidate number is 391. Can I please confirm your name and date of birth?
I'm 23, Bianca.
Nice to meet you, Ms. Bianca. Today, I have been asked to examine your shoulder joint. That would include me looking at your joint, feeling the joint and the back of your scapula, and also performing some movements on the on your joint, shoulder joint. Is that all right with you?
Yes.
All right. So first, we'll start by looking at your shoulder joint. Do you have any pain on either of the shoulders?
When I move, yes.
All right. Okay. So I'm going to be as gentle as possible with you. Okay. And if you feel any discomfort at any point of the examination, please let me know. Okay.
Yes. And you
All
can say
right.
if you need any analgesics before I begin, you can.
Do you need any
All right.
analgesics before I begin?
Continue. Yes. No, that's all right. Continue, please.
All right, then. So first I'm going to start by looking at your shoulder, okay? So I'm going
Okay.
to start by looking at the front of your shoulder, your clavicle, your, then if there is any scar mark, if there is any
Yes,
swelling,
you have to
and then skin
instruct
condition.
my position and my
All right.
exposure.
If you could just stand and you could just take off your trouser, take off
Yes.
your shirt. You can keep your undergarments on.
All
Yeah.
right. Okay.
Okay. So now I'm going to start by looking at your shoulder. I'm going to look
Yes.
from the front, and I'm going to see if there's any scar mark, any swelling, any deformities, if there are any overlying skin condition. Then if you
Yes.
could turn to the side, please.
Yes.
And then I'm going to look from the either side to see if there's any swelling, any again scar marks. Then
Yes.
could you please turn back for me? All right.
Yes.
Here I'm going to again see if there is any deformity, if there is any swelling, scar marks, skin condition. Now, if you could kindly put up your hands, both your hands outwards as in pushing against a wall.
Okay.
Here I'm going to see, like this. Yes. I'm going to now see if there is any winging of scapula. Okay. So Ms. Bianca, if you could kindly again turn towards me.
All right.
Okay, so now I'm going to feel for your joints, okay? You can be as comfortable as possible. I'll be as gentle, all right?
Okay.
So first I'm going to start assessing the temperature of both the shoulders, compare the two. Then I'm going to start palpate. I'm going to now feel for your joints, okay? I'm going to, so you tell me if you feel any pain. So I'm going to start by slowly palpating the from the medial end of the sternoclavicular joint. I'm going to begin palpating that. Then I'm going to move to the acromion process, the coracoid process, the head of the humerus. Now again, I'm going to do the same on the other side, on the left side. Now, if you could kindly turn back for me.
Yes.
All right. So now I'm going to again start palpating the spine of the scapula, the medial border of the scapula, and whilst I'm doing some, look at the patient's face to see if there is any wincing. Now,
Okay.
all right. After this, now I'm going. If you could kindly turn back towards me.
Yes.
All right. Okay. So now I'm going to ask you to perform some movements. All right. So if you could kindly follow me as I'm doing these movements, could you please bring your arms closer to your body like this, as in crossing in front of your body. Then could you take could you take them away and above your head and then cross them as far as you can take?
Okay.
Okay. And now if you could kindly cross your hands behind your back for me like this.
Okay.
All right. Now if you could bring your arms to either side of your body stiff and then take only take your elbows outwards for me, both the elbows. All right.
Okay.
Now, if you could bring them inwards for me.
Yes.
Okay, so now I'm going to perform this. Ms. Bianca, now I will perform these movements for you and you can relax. Okay, I'll be as gentle as possible with you. So I'll again do flexion, extension, abduction, adduction, external rotation and internal rotation, and whilst feeling for any crepitus or any stiffness of the joints.
Okay.
Now, Miss Bianca, I'm going to perform some special tests on you. So the first I'm going to do is the empty can test. So first I would like you to follow my lead. Could you please bring out your right hand outwards like this, extend it outwards, and then
Yes.
make a fist and your thumb pointed upwards, and then turn it down as in emptying a can. Can you do that for me?
Yes.
All right. So now I'm going to try to push it down. You're going to resist for me. Okay. Can you do that?
Okay.
All right. So I'm going to apply pressure on the hands and you're going to resist. Now I'm going to do the same on the left hand. After this, now I'm going to take your hands, a right hand above your head, and then I'm going to let it go. You're going to slowly bring it down back to the side of your body. Whilst you're doing so, you're going to tell me when you feel the most pain. Okay?
Okay.
All right. So that is, I'm going to do the painful arc to see when the patient feels the most pain. Now, if you could kindly cross your hands behind your back. Okay. I'm going to do the painful arc with the left hand too. Then I'm going to now, if you could kindly, Miss Bianca, cross your hands behind your back like this. I'm going to now try to push your hands against your back. You're going to try to lift them off or try to resist them. Okay. Can you do that for me? All right. Yes. So now I'm going to see the Gerber lift off test. Okay. Now I would like you to please, now I want you to extend your bring your arms to the side of your body. Now and try to take out your elbows outwards, and I'm going to try to resist it. Okay. Okay. So all right. And now
can you summarize your examination, please?
I have just examined a 23-year-old young lady who's presented with pain on both the shoulders. On examination, on inspection, the patient there was no scar mark or any deformity or any skin changes over either of the shoulder joints. And on palpation, there was slight tenderness over the right coracoid and the acromion process on the head of the humerus, right humerus. There was no winging of scapula. Then the patient's empty can test and the painful arc test was positive, but the rest of the
to
tests
what
were
degree? To what grades?
The empty can test was the painful arc was up to the patient could reduce it. Could abduct it up to
between 60 to 120
between 60 to 120 degrees, and the rest of the tests were equivocal. Her movements, so there was
considering your examination, what is the provisional and differential diagnosis you'll consider?
I would consider, first of all, impingement arc syndrome. Then I would consider probably rotator cuff tear. Then also frozen shoulder.
Okay, good. How would you confirm your diagnosis, or what investigations would you ask for?
To confirm my diagnosis, I would take a thorough clinical examination and assess the patient's sensory examination and also examine the cervical spine and the elbow joints. I would like to do some investigations. That is, I would do an X-ray of the shoulder joints in both views. And I would like to do an MRI of the shoulder joint to exclude if there's any ligament tear, any muscle tear, and also and check the patient's baseline blood investigations like complete blood count or a random blood glucose level to exclude if the patient is having diabetes.
Okay, all the reports came out and they were correct. They were normal. You couldn't find any abnormality. Then what would you do next to confirm or to establish your diagnosis?
Then in that case, I would like to go for aspiration of the shoulder joint fluid and study of the fluid analysis.
Okay. Patient is professional swimmer. What would you advise?
So advice would be, first of all, since the patient is initially rest to the shoulder joint
For how
and
long? Patient
for
will
at least 6 months,
Okay.
and then a physiotherapy of the joint, and with either usually then analgesics according to the World Health Organization analgesic ladder, and if none of these improve the patient's condition, then we could possibly offer surgery to the patient.
Surgical exploration. Okay, good. There is